"24 hours a day, 7 days a week, our bodies are constantly burning energy. Sometimes we need to produce a lot of energy quickly when we do a strenuous exercise. But even when we are asleep, we are burning energy. It takes a great deal just to keep our bodies warm. This energy comes from the food that we eat. Some foods are broken down by our stomachs to give us energy slowly and gradually. But others are broken down much more quickly and enter the blood as sugar soon after we eat them. Sugar, sometimes called glucose, is the main fuel that keeps us warm and keeps us moving.
Sugar timanena kuti ali mitundu iwiri. Pali sugar yamba imene pachizungu amati type 1, nde pali ina type 2.
Diabetes is a condition where the body cannot process the sugars in the normal way. Usually, when the body has sugar in the blood, it automatically produces a substance called insulin. Insulin moves the sugar from the bloodstream into individual cells all over the body to give them energy.
So insulin is a hormone which is naturally produced by the body from an organ called the pancreas, which is sort of situated in your upper abdomen, in response to changes in glucose in the blood. So if you eat a meal, a lot of the food that's digested is converted into sugars and is absorbed into the bloodstream, and the pancreas is able to detect the rise in glucose and will release insulin. And what the insulin does is it moves glucose from the bloodstream into the cells.
In people with diabetes, this process does not work properly. Either they are not producing insulin, or the cells are unable to respond to insulin, so the insulin no longer works. This is called insulin resistance.
When you have no insulin or resistance to insulin, as occurs in type 1 and type 2 diabetes, the sugar stays in the blood and it can't enter the cells. So that has a double whammy on your body, if you like, because you get all the symptoms associated with high glucose, but your cells are craving energy. They're depleted. And so the body basically winds down and you become increasingly tired. And in order to try and compensate for that, the body looks to alternative energy sources. So if it can't utilize glucose in the cells as energy, you start to break down your body fat to use as energy, and you start to break down your muscles to use as energy. So people with poorly controlled diabetes lose weight and they lose muscle strength. And you see people who are really very, very thin, and it's all just due to the diabetes and the fact that their body is trying to produce energy in the face of a glucose deficit in the cells.
Diabetes is not a disease that you can pass on or catch. It is a condition which often runs in families and can be triggered by an illness or infection. There are two major types of diabetes, known as type 1 and type 2. Type 1 diabetes usually presents in children or teenagers. The pancreas fairly suddenly stops producing insulin. Usually the person becomes very ill quickly. Once the pancreas has stopped working, it does not start again. So people with type 1 diabetes need to have lifelong insulin injections to replace what the body would normally produce. With these, they can learn to control the diabetes and live healthily. Type 2 diabetes usually starts in middle or old age. It is much more complex. The onset is often slow. Sometimes the pancreas does not produce enough insulin, but often the cells of the body also become resistant to insulin, so the normal method for processing sugars does not work. Sugar is to the body what fuel is to a car. If the mechanism for getting the fuel into the car and turning it into energy doesn't work, then you have a problem. Too little or too much sugar are both bad. Having too much sugar in the bloodstream is very harmful. But if there is too little sugar, or it is not reaching the cells to provide them with energy, then the body stops working. It shuts down. Without treatment, diabetes is very dangerous and will kill. Fortunately, today there are good treatments. People can have insulin injections to replace the insulin the body is not producing. Or they can take medication which stimulates the body to produce its own insulin and helps regulate the process of turning sugar into energy in other ways. But these are treatments that must be taken every day for life.
It's important that people who have diabetes or people who care for diabetic patients understand that it can be fatal, but the vast majority of diabetics can live with their condition very well. And I think it involves understanding what diabetes is, understanding how they can regulate their sugar. And if you can do that, you can actually live, for a long time quite healthily with diabetes.
Living successfully with diabetes is a balancing act. Most people's bodies automatically regulate the amount of sugar in their blood. Someone with diabetes doesn't have this automatic function, so they need to learn to do it themselves. They have to learn to carefully control their diet and then use the medication and treatment in the best way to allow them to live life to the full. This means, above all, understanding how diabetes works so that they can learn to help themselves.